So how we did it. You'll see here that we've leveraged both of Coeo's um, main data centers, right? So there's a local one here for us in Oak Brook, and then we're also leveraging the data center in Denver. And we have multiple routes. That fiber does not cross over. It was done deliberately. We don't want to have any redundant, non-redundant legs in our fiber infrastructure as it relates to the PSTN connection that we have to Coeo. So we've got 3 different data centers here. This slide actually was updated recently because of our inclusion into the Wisconsin market. So we've got a Park Ridge data center, another one in the Chicagoland area, and then we now have a third one that we've stood up in Wisconsin. So these all can fail over to one another. You'll see the HA stacks within the data centers that will fail box to box if need be, all the while keeping the calls active. So very important to us. That centralized trunking drops into either Oak Brook or Denver and can drop into any one of these data centers using, we could talk about all kinds of different routing options. And some we leverage depending on the business needs. So the ability to route from data center to data center to data center for us has been absolutely instrumental. We'll have another slide here in a minute where Kevin will show how we're going to take this to the next level. But really centralizing this overall and being able to distribute it and using our redundant WAN connections out to our hospitals has been a godsend for us, because rather than building 4, 5, 6 PRIs, at each individual site, we realized, we've overbuilt it right from the get-go. And we did that because with high census, we could potentially see all 6 PRIs used, but typically we don't, right? We see 2 to 3 on average, and then we had some extra ones in there. So we did a lot of pruning to be able to centralize it and then built the capacity that we would need for high census times. Let's say if it hits Libertyville versus some hospital in Grafton or the greater Milwaukee area, it allowed us the ability to have plenty of redundancy, plenty of capacity, because we've never seen it where we've got high census in all of the areas at once. So a lot of cost savings provided to us there. What you'll also see there in the middle section is, we label it location X. That's a very typical solution there. So we've got the Sienna, and the managed router being dropped in there. We'll have our 2K, and that is local survivability. We have had instances where a hospital site has been completely disconnected, whether that be a planned or unplanned event, where we've lost WAN connectivity back to our data centers. We still have a alternate data route back from the Coeo cloud, from the PSTN, that allows that dial plan that's germane to that location to be able to be survivable at the 2K level, and that's a smaller SBC. So you'll see there that we chose Ribbon, what was once Sonus, as our solution preference. Our security team preferred it, so it kind of made, and our network team preferred it, so it made it a very easy choice for us. And it happened to be what Coeo has been using on their end, and obviously providing to us as well. So a couple last points here, and we could do a deeper dive if anyone's interested. Certainly we could do deeper dives, but we've now tied our SIP trunking into our instances of WriteFax. That's our enterprise faxing solution, simpler from a timekeeping perspective. In Genesis Cloud, Genesis i3, all get front-ended with Coeo trunks using our SIP services. So this enterprise platform has grown to just more than just, what was originally intended, and that was, to root out our PRI woes at the hospital level. This has morphed into a much bigger solution for us in Advantage to Health. One of the last things I'll say about this is its integration, its design, very simple overall. I mean, I know there's a lot of lines and all that good stuff, but when you really sit down and look at it, the architecture is very simple, and it's allowed us to be self-supported and manage it on our own with our own engineering staff, I think, which is extremely important. So moving on to the next slide, it's going to talk about the advent of a policy and routing solution, as well as an element management solution, also by our friends at Ribbon. And I'm going to let Kevin kind of talk to what's next.
Sure. Hey, Joe, thank you. So real quick, just 8 years ago, when we started talking with Advocate about their needs, right? This was the plan. The vision was to bring them to a solution that was centralized to allow their staff to quickly and easily manage all of their nodes. And with their expectation of mergers and acquisitions down the line, right? This feeds into that system to allow them to add in new markets and be very, very low cost on their support side of things, right? So when we bring in the EMS and the PSX to the model, it allows us to have an element management system that not only manages all of their SBCs that are in their data centers, their high availability ones, but all of their edge devices that are sitting out there handing off, like Joe said, for survivability at a branch location for those PRIs or FXS lines. So all of that can be managed in one single pane of glass, all the SNMP traps, all the backups and configuration and any type of maintenance activity is all driven through that EMS. And it gives Advocate support. They can ramp folks up very quickly, as opposed to trying to teach them, 15 different platforms to manage the different nodes. So that's been a real big win for them. And then the PSX, the policy server engine, and it's the centralized routing logic. And so each one of these SBCs on their own can do what's called an embedded routing engine. And so you can stand alone. And we see that across, some smaller organizations that don't have multiple needs or multiple locations, and you can manage that in one spot. The advantage of a centralized is you manage it in one place, and routing from all 3, all 6, all 10 nodes, however many you have, all understand that routing logic, and you just have to build it once. So if we want to build routing logic that sits off a Summit DC, when Serco, the user in Serco makes a call that does a dip into the PSX. PSX says, oh, that route lives off of Summit, right? We don't have to build things in Serco and LGH and all the enterprise SBCs to understand that route exists in Summit. The PSX gives that logic to each SBC whenever they need it. So it creates this very, very simple, but yet very complex routing logic that the team can take advantage of, and they can scale so quickly without having to worry about having to go to each location and make sure all the routes are built when a new network gets put on, or a new routing instance gets put into their network. So it's been this is where we're working to. We've gone from some steering digit logic from our side to them, and they're ripping all of that out. Now they're doing everything 10 digit. And they can steer it really much like a carrier, right? So I look at Advocate as another carrier with logic that they can implement at their level. So they can now, take advantage of keeping on-net calls and things like this. They can steer digits. They can do whatever they need to for like a right-back solution. They can keep all of that stuff on net without having to pass it back up to the carrier to then pass it back down to another trunk group. So it gives, all the control that Joe and his team were looking for in their hands. And, it's been a beautiful thing. We have some provisioning tools that we allow their team to modify routes in our Coeo network. So if we wanted to preference, if they're going to do a maintenance, they can move all their traffic to the Summit DC while they do work on their LGH location. And they can do that all on their own. And it provides that level of confidence where they can surely call us, and they do. We're on the lines, but if they need an emergency maintenance and they don't want to call us, they can do the work on their own if they feel confident. And I think that's what they were looking for. And so the beauty of Advocate Healthcare's deployment is that from a Coeo perspective, it really encompasses everything we see in the marketplace, right? No matter what industry it is, we have some smaller edge SBCs handing off PRIs for systems that, you know, they just bought the PBX a few years back and they want to keep the PRI. They're not ready to go to SIP. Well, we can enable that SIP to the core for them and take advantage of, you know, we can throw in like an SD-WAN solution so we can get high availability on a PRI handoff to a PBX by, you know, floating IPs across two ISPs. So a very simplex solution that gives you a great value of return, right? If you're not capable of buying the HA SBCs like Joe and Advocate have, you can still realize probably the biggest failure point in any industry is a circuit failure, right? So we can help with those types of solutions. And then obviously, as you get, you know, more and more high available needs in different markets, such as banking or healthcare, then you can purchase these SBCs that have the high availability, and we can help with that transition at your pace, right? And so that was a little bit of what we did with Joe and their team. Was we started at the edge and we built out to the core and got to that centralized location. And really, from a Coeo perspective, we're Coeo Solutions for a reason. We want to provide the solution that makes sense for you and your business. We're not trying to push our agenda. Our agenda is to make you happy. So that's kind of really what we've done and really implemented here, and looking forward to making your life even easier, Joe, here as we finalize this rollout with the EMS and the PSX.